population is essential for the development of any country. So it is often top priority in the policy decisions of government. Nigeria at some point in her national life was a beacon of hope in African health care, a destination for quality service. That looks like history now, considering the myriad of challenges confronting the sector, from decaying infrastructure to inadequate manpower and high cost of health care services. The public health facilities are mostly affected. From the eyes of the administrators of Nigeria's healthcare system, however, it will seem like a policy journey always intending to restructure the system to serve the people better. Considering the various interventions to make the engine of the system run smoothly, one might wonder what is the challenge. Like previous administrations, the Tinubu-led government is concerned about the well-being of citizens. And to ensure that all is well, healthcare sector made the list of top priority sectors for attention. With a performance target to aim at also, it is safe to say, how far so far? These questions we hope to answer on this special edition of Health Options. Stay with us as we x-ray Nigeria's healthcare system in the last 2 years. It is always a pleasure to have you join us. I am Salwa Khalil Ibrahim.
Kuka that's the name in Hausa.
That is call it Ose.
In Yoruba.
Ose, Igi Ose.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density hypoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
In 2023, President Bola Tinubu took the bull by the hand through the Nigerian Health Sector Renewal Investment Initiative, encompassing primary healthcare system, reproductive, maternal and child health services, which is expected to improve the population health outcomes under the Ministry of Health and Social Welfare. 2 years after, have these initiatives yielded any results? We will be finding out after this short break, when I will be sitting with my guest who her capacity in government will spread the scorecard of the health sector. You don't want to miss it. My guest is a public health physician and a special advisor to the President on Health, Dr. Salma Ibrahim Anas. Many thanks for joining us on Health Options.
Thank you very much, and good day, Nigerians.
Okay. Now, to begin with, with Tinubu administration's emphasis on health and social welfare since 2023, it's clear the health sector importance is now acknowledged. What drove this change in policy focus?
So thank you very much. I would like to briefly take us to the background, and to God be the glory, celebrating 2 years of administration and leadership of His Excellency President Bola Ahmed Tinubu. And his vision for Nigerians started even before the election. So in the health sector, he had a vision, he had the priorities for Nigeria, which fortunately I was part of articulating the mandate and the campaign promises around 8 key areas. And then after the election, His Excellency, for the first time in the history of Nigeria, established the Presidential Advisory Committee Presidential Advisory Council, which was led by the current Minister of Finance, Mr. Wale Adun, and also the Minister of Planning, Alhaji Atiku Badugudu. So under it, we are to focus on key sectors of development, and among which is health, education, the economy, and also agriculture, women development, and those were the key areas, and then the financing. So I was opportune to work also as of that time as the chair of the subcommittee of the Presidential Advisory Policy formulation around that time, which we refined the mandate and campaign promises of President Bola Ahmed Tinubu around 8 key areas. So I will quickly mention the areas so that we know where we are coming from, and then we can now, 2 years as of today, we will be able to ascertain the progress that we have made within the health sector.
Okay.
One of the key pillars or the priority of President Bola Ahmed Tinubu is to ensure that the governance of the health sector becomes very effective, very transparent, efficient to deliver healthcare services for all Nigerians, irrespective of where they are. And then the second aspect of it was also focused on financing, increased budgetary allocation, looking beyond government to mobilize additional resources, for funding for the health sector. So those were the second pillar. And then the third was on human resources, for health, to fill in the gaps of human resources for health and to be more innovative, and then come up with a more strategic policies and direction in terms of motivation of human resources, increased production of human resources, as well as the quality of human resources that will work within the whole entire spectrum of the healthcare delivery. Then another aspect that we also worked on that was a priority, one of the 8 key priority areas, is on integrated health that will enable Nigerians to have access to quality healthcare services. And this is looking across the tertiary institutions, specialized care, which is federal medical centers, teaching hospitals, orthopedic hospitals, neuropsychiatric hospitals, and all specialized cares, including fistula hospitals. And then secondly, the level of the secondary level of care, which is under the responsibility of the state subnational government, and then the primary health care. So the focus is to see that how do we ensure that all those services are linked together and support each other with capacity building, mentorship, to ensure that the adequate services are provided to all Nigerians with a view to achieve universal health care coverage. We also have other aspects like public health emergency response under the global health security. We also have partnership. We also have another area which focuses on local production, local manufacture of medical medicines, drugs, assembly of medical equipment in Nigeria, so that Nigeria will be self-reliant and self-sufficient. And lastly, about the partnership. So those were the 8 areas the president identified even before election and promised that he's going to take it forward. And fortunately, this is where we are today, 2 years later, to see what progress we have made in those key areas.
Okay. Given everything you just mentioned now, what's your take on the progress so far, looking at, everything you've mentioned? Where are we now?
There are lots of success stories. In some aspect, one can say we have even achieved more than what we have laid to achieve within the first 2 years. Because what we did was to have a short-term indicators within the first less than 3 months, and then the 2-year midterm, and also the 4 years. So this is the midterm, and one can categorically say it and congratulate Nigerians that a lot of progress have been made. So under the leadership of the Coordinator Minister of Health, he took all these priorities of the president, the campaign promises, and also came up with an approach and processes of how best to deliver and realize. And I'm happy to say that we have been on track from the areas that he has done, because he deployed new innovations and a new way of ensuring that we achieve the promises of President Bola Ahmed Tinubu under the Renewed Hope Health Agenda. So he came up with what he called the sector-wide approach, and also the National Health Sector Investment Initiative, which galvanizes all existing efforts and bring all efforts together in terms of resources, human resources, financial resources, political commitment, not only at the national level, but sub-national level, including all donor support and development partner support under one umbrella to deliver. And he prioritized also under the 4 areas what is called the population health, the security aspect of it, the presidential health value chain, unlocking that, and also other aspects of partnership and then healthcare delivery. Okay. So when you look at all those, one can categorically mention, and if you take it back also to the renewed hope health priorities of President Bola Ahmed Tinubu, one can mention in each sector what progress have been made. So the first the president did that time was to ensure that all subnational governance, the government, aligned with his priorities. And that was what he launched, if you recall, as early back as December 2023, where all the governors signed a compact agreement, which is an agreement that they've aligned with the priorities, and they've aligned to align all resources and also committed to ensure that they also deliver along with the president at the subnational level. I think this was achieved, and a lot of governors have demonstrated that commitment. Another area is when you look at the financing area, the success story. Immediately, His Excellency President Bola Ahmed Tinubu expanded the national health insurance coverage for Nigerians by increasing also the basic health care funding, which has been in the pipeline since 2018 and has been operational. But what he did was to increase and boost that basic healthcare funding, which comes from our 1% consolidated revenue fund. Yes, so that was expanded, and the whole idea is to increase the coverage of healthcare for vulnerable people, and also the vulnerable fund. So which means from 8,000 PHCs that we've had in the past 2020, as of 2023, to increase it to realize the double it to up to 16,000 by 2014. And I'm glad to mention that over 1,000 primary healthcare facilities, as of today we are talking, they have been rehabilitated, they are functional, in the words of Nigeria, in each local government of the Federation. And over 5,000 are also in the pipeline at different levels of completion. So if this is done within the next few months, it means we have almost surpassed the indicators that we have agreed for primary health care. So that is in the area of that. And then if you take another area, still in financing, you can see that His Excellency President Bola Ahmed Tinubu, in partnership with the legislators, has sustained increment, which has continued over the period from 2023 budgetary allocation, 2024 budgetary allocation, and today at 2025, there has been an increment. And the budgetary allocation is slightly above 5% as we are talking. So those are demonstrations in terms of financing, that are domestic financing, and also this is just at the national level. But in addition, a lot is also happening at the subnational.
Allow me come here then. Considering everything you've mentioned, these successes recorded, do you see Nigeria achieving the SDG target in health reforms before the 2030, target?
Yes. So what I can say is that because we have been lagging for a very long time in the attainment of the SDG goals, but in the last 2 years, a lot of action has been taking place, and then in a very trajectory manner, very aggressive manner, if I may put it that way. So we are going to achieve quite a lot in terms of where we are starting from. So, for example, I would like to share it with you with concrete examples. Today, one of the areas that we score badly is maternal mortality, which Nigeria is one of those countries that have the highest, burden of maternal mortality. From the demographic health survey, the National Demographic Health Survey recently, it showed that at least 33 local governments of Nigeria, 33 states in Nigeria contribute to the highest burden. So currently, under the leadership of the Ministry of Health, there is an aggressive action to ensure that we reduce maternal mortality. And actions are being taken at that level to deploy resources, to deploy human resources, to build capacities of healthcare providers. And part of what they are doing also is to provide services, free for women at that level. Emergency services, the comprehensive emergency obstetric healthcare services are also deployed at that level. So with the actions being taken, we are hopeful. As we said, Nigerians should renew their hope in this administration, and that's why we call it renewed hope. We are very hopeful that by 2027, we are going to see a drastic reduction and what I call the acceleration of reduction of maternal death in this country, as well as the death of newborns, because we are beginning to see increase in uptake of antenatal care services, increase in delivery by skilled birth attendants at our health facilities. So those are positive indicators, and those are the trend that we hope to continue to build upon And then we are beginning to see increase in coverage of immunization activities.
Okay.
Nigeria is one of the countries that have launched the cervical cancer vaccines, and today we have almost 90% coverage of the target population of young girls that are being vaccinated. So,
Okay.
so those are positive trends, and those are indicators that Nigeria is on track. In fact, we are making very, very rapid progress towards
beautiful,
attainment of
Doctor.
the
Allow
SDG
me
goals.
to pause you there. Let's take a short break here. When we come back, we take off from where we stopped. Join us again.
Thank you.
Administration of President Bola Ahmed Tinubu is committed to going beyond stabilizing the economy to achieve rapid, sustained, inclusive growth.
Our GDP growth has been evident, and we've seen commendation from IMF and development financing agencies who have commended our reform efforts.
Within the last 2 years, we completed the implementation of the Nigerian electrification project.
Even in the southeast, era of unknown gunmen has significantly gone away. We do not have such incidences anymore.
To build a nation of prosperity, embark on bold endeavor so that your country can be successful.
Kuka that's the name in Hausa.
That is call it Ose.
In Yoruba.
Ose, Igi Ose.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density hypoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
Welcome back. If you just tune in, the program is Health Options and the NTA, and we have been looking at effort by the government in strengthening healthcare in Nigeria in the last 2 years with the special assistant to the president on health, Dr. Salma Anas. Thank you for being there, ma'am. Now, we have had the achievement made thus far, but I'm sure they are without some challenges, however. Why are we still seeing persistent gaps such as doctors shortages, inadequate infrastructure, and even, unequal access to quality care, especially at the primary level?
So let me start by saying that one of the commitments of President Bola Ahmed Tinubu under the Renewed Hope Health Agenda is to ensure equity in delivery of healthcare services and attainment of universal healthcare coverage, leaving no one behind for all Nigerians, irrespective of your socio-economic status, irrespective of your gender, irrespective of your age. So it covers everybody across board. And the government has demonstrated commitment in doing that over the last 2 years. So of course, the journey is not without challenges. There are challenges. And what you have raised about human resources for health is a huge challenge. Migration, not only of doctors, but healthcare providers, including nurses, midwives, laboratory scientists, pharmacists, they are all migrating. And this is a global phenomenon. It did not only affect Nigeria alone, but we have witnessed an increase in migration of healthcare providers in the last 5 years. So, for example, evidence have shown that in the last 5 days, we lost over 6,000 Nigerians that have migrated due to one reason or the other, some for their own personal benefit, some to gain skills. So people have different reasons for doing that. But this administration is committed to ensure that we retain healthcare providers by providing an enabling working environment, by motivating them. Recently, you will agree with me, and you must have heard it in the news, that His Excellency President Bola Ahmed Tinubu increased even the age of retirement for healthcare providers up to the age of 65. I think this is highly commendable. And this is very pragmatic way of doing things to ensure that we retain our healthcare workforces. And under the leadership of the Minister of Health, Professor Patti, he has also developed a very laudable and innovative policy on health force migration policy that will help us to ensure that if we effectively implement, to see that we retain healthcare workers, we don't only retain, but also we attract healthcare providers in diaspora. And we have a good agreement with the countries that they are going. Most of the countries they go, they are developed countries, including also the Middle East, apart from US, UK, and Canada. So how do we retain them? I think the policy has clearly spelled out that. So a lot of efforts are ongoing. And in the last 2 years, there has been increased also efforts in the production of healthcare providers. I will take an example with the School of Nursing and Midwifery, which has been upgraded to colleges of nursing and midwifery today. And there is a massive increasement in the enrollment of trainees in those two institutions of training, and also other schools like the School of Health Technology, including also our medical schools. So these are actually steps that have been made in the last 2 years, and we are seeing the successes of that, which is resulting in an increase. So apart from that, a quick measure that was also deployed was capacity building, training of the frontline workers that will work at the primary healthcare facilities, to ensure that there is no break, there is no interruption, so our health providers are available. And there has been massive training in the last 2 years, you know, of healthcare providers at the local government level.
I wish we could go on and on, you know, but on a final note now, and briefly, what should we look forward to, you know, in the next half of this administration, briefly now?
So in the next half is to consolidate the foundation that have been laid in the first 2 years, the effort, and to boost it and to realize and to ensure that they are sustained and continuity, it continued at the subnational level. So we are looking at issues of institutionalization, issues of integration, issues of sustainability, and the buying in of everyone, including our traditional institutions, religious leaders, private sectors, philanthropists, and everybody should take health as a personal responsibility and key into the renewed hope health agenda of President Bola Ahmed Tinubu.
Dr. Salma Ibrahim Anet, it's been an insightful conversation. Thank you for coming on Health Options.
Thank you so much.
So much to talk about, but our time is up. You can watch these and previous episodes of the program on YouTube at NTA Networks. We welcome your comments, questions, and suggestions. See you again next week.